Dr. Kandil.
Philip, how are you?
Good, how are you?
Welcome to New Orleans.
Man, this is awesome.
Yeah.
Is this what you usually do on a Saturday?
This is the Cafe du Monde.
Famous Cafe du Monde.
Yeah, with the famous Cafe du Monde. We're gonna get you some beignet and some coffee.
Beignet and coffee?
Yeah.
Beignet?
Yeah, absolutely. Right
Why
now.
not? Yeah, sure,
Let's
why
do
not?
it.
Let me grab a chair.
Sometimes, yeah?
Sure. All right.
Thank you.
All right. Thank you.
Whoa. Beignets?
Beignets.
These are fat-free, right?
Fat free. Yes, I'm about to fry it and nice and hot.
Wow. So beignets is okay to eat, Doc?
Enjoy, man. Let me tell you something. After you eat whatever, if you just walk as if you took some metformin, diabetes medicine, but we are going to walk and we're gonna work out and it's gonna be CrossFit.
Did you just say we're
So
gonna
just
work
enjoy.
out?
Yeah, we're gonna work out
Wait a second. Today?
today. Right now, we're gonna just walk and get to the gym. Let's do it.
So a little beignet, coffee, go for a walk, go to the gym. Cheers to the beignet.
Cheers.
That's New Orleans. Right?
It's perfection.
Nice spot.
That's pretty good. That's good.
Yeah, last time I was here was almost 30 years ago. It was the Super Bowl.
Oh my God.
49ers against the Bengals.
Yeah, New
Came here
Orleans
with my
never.
dad.
New Orleans always fun. Yeah.
It's awesome, man. Hey, Dr. Kandil, question for you. What inspired you to be a doctor?
I believe I mentioned the story before. So I actually loved math and I wanted to be an engineer. But at the time of the application, my brother, he was really like a baby at that time. He lost consciousness, got into seizures, and I thought he was about to die. So at that time, there was no like ERs and stuff like this. So I just took him in my hands. I ran to another building where there is a doctor who's there. And he just gave him a shot and my brother was back to life. And I'm like, this is unbelievable. I'm going to be a doctor.
How old were you?
I was 17 at that time, yeah.
Well, why did your brother lose consciousness?
Well, that's the best part of the story. Eventually, after going to medical school, I learned that there was some seizures and he came back on his own and most probably whatever he got is nothing. And
But
it
it
just...
was enough to inspire you.
Absolutely, it made me a doctor.
Really? From watching a healthcare professional when your eyes at the time of 17 saved your brother.
Yeah, I believed he saved my brother's life, and I'm like, this is the best thing in the world. I'm going to be a doctor.
That's cool. Good story.
Yeah.
Okay, beignets were great. Coffee was delicious. Where are we off to?
We're up for the gym, man, and we're gonna
Seriously?
do CrossFit.
Really?
We're gonna do CrossFit. Let's do some CrossFit. Yeah, we're gonna
Okay.
run. It's Saturday. We gotta catch the CrossFit class. Yeah.
Okay.
Let's do it.
So this is where it all happens.
Absolutely.
This is the gym?
It's gonna be fun, man.
Oh no, man, for 1 hour?
Yeah, let's do it.
Seriously?
Yeah.
5 times a week?
Yeah.
No kidding.
Yeah, man.
And this is your routine?
That's my routine.
Only when you have beignets? I enjoyed it, thank you.
Go to the Audubon Park.
Go for a walk?
Audubon Park, man.
It's beautiful. I came by there on the way in.
Most beautiful thing.
So Dr. Kandil, we had a nice workout.
Yeah.
It was good.
By the way, that was an easy one. It's a deload week.
Really?
We did not do any Olympic lifting. That was just easy CrossFit workout.
So sometimes you get more intense.
Oh, a lot of times.
Yeah.
This
Hey,
is just fun.
Dr. Kandil, I'll tell you something. I mean,
But you did really good. I was impressed.
really?
That was good.
It felt good to get a good little activity.
it was good,
You know,
good.
especially after traveling.
You
You
did
just
really
end
good.
up sleeping better
That
afterwards.
was impressive. Yeah.
But you seem, from our conversations, you're very committed to health and fitness.
Well, the data is very clear that if you do exercise to its full leverage, this is the number one reason to improve both lifespan and health span. Lifespan is how long you live, health span is how good you live.
The quality of life.
Absolutely.
Yeah, no doubt about it. And a lot of the research now is all about being endurance. As a matter of fact, resistance training with weights
Absolutely.
to make
I mean,
yourself less frail as we age.
powerlifting is one of some research said that's actually the number one exercise that's anti-aging exercise. But I believe in a combination of different kind of exercises like powerlifting. You gotta do at least a couple of cardiac a week. This will definitely improve both the lifespan and the health span.
So for you,
It will just make you enjoy life. It releases the endorphins and make you enjoy the gift that God gave us.
quality of life.
Quality of life.
Yeah.
Absolutely.
It's all about quality of life. And for that being said, quality of life. You know, something we're talking about in this video is thyroidectomies and thyroid nodules. How
So-
does that play into the quality of life narrative?
So thyroid surgery is a must for many patients. However, it can definitely affect the quality of life. 1 out of 5 patients after removal of their thyroid, they will never feel normal again, despite they are very compliant and they have normal thyroid function and they're taking their medications and everything looks good on paper. But we are not machines. Nothing like the gift that God gave us inside us, the factory that's inside us. So if there is no real reason to remove the thyroid, now we do have many other options to avoid the need for that.
Well, you know, and you're living proof of what it's like to have an active lifestyle. And like you said, when the thyroid is removed, things change, the body
Absolutely.
changes.
So there are a possible risk of complications, and these complications can be very serious complications and can really affect the quality of life with hoarseness, difficulty swallowing. It can be really detrimental. But even with a very good surgery with no complications, in my opinion, one of the worst outcomes is the loss of this important vital organ and inability to compensate for the thyroid function, despite that the patient is trying to be very compliant and you can't do anything about it.
I've done some background research on you, and you just said that vital organ, and when you remove it, things just aren't the same. And you talked about preserving an organ that your body was given and try not to take it out, but I think it's important to emphasize right now for anyone watching this video that you're a surgeon. You have done thyroidectomies, but you've also done almost maybe more than 1,000 ablation procedures where you avoided a surgery. And my question for you is, you're a thyroid surgeon. You get paid probably more money to do a thyroidectomy, but many times you're advocating to your patient to not do a thyroid surgery and to do what you call a thyroid ablation instead.
I get paid very well for doing thyroid surgery, but we are not here for business. I would like to really make an impact on patients' life. You know, a big part of what I do for a living is research. And I believe with research you can help identify findings and solutions for problems that can affect not just certain number of patients that you operate on, but a significant number of population and help humanity. And by trying to avoid thyroid surgery when you can avoid it, it's really just something just very satisfying, and patients are very grateful and very fulfilling. You know, when you have a patient with thyroid cancer and you're able to treat this and make even the cancer disappear without surgery, I honestly feel significantly more fulfilled and happier than just removing it.
Okay, man, this is awesome. I just heard you say a couple things that caught my attention. One is that you're treating patients with thyroid cancer without surgery. You're preserving the thyroid. I think if there's any part of this video for a patient watching, that we should highlight that in big capital letters, that you're treating patients with thyroid cancer without surgery, preserving the thyroid. And then you're also saying that just that, what happens when you preserve the thyroid whenever possible?
Absolutely. So we do thyroid surgery for thyroid cancer, but for many other benign diseases. When you have a large thyroid causing compressive symptoms or hyperactive thyroid, and these are very easy to manage with non-surgical options too. But for cancer, we just learned that you just have to take the cancer out. But recently, over the last few years, we've been talking about active surveillance, monitoring the cancer, and just watching which one will progress and which one we can just actually monitor. Well, how about this right now? We have an option to just completely eradicate the cancer, or at least eradicate most of the cancer without just watching it and hoping that it's not going to spread. And we do have the modalities to do that. So I think it's just a great breakthrough, and I believe many patients with thyroid cancer can benefit. Additionally, many patients with benign disease that we used to offer thyroid surgery for can absolutely benefit from this. In my own practice, over the years, I mean, I've been in practice for like 20 years now, and I performed over 5,000 of these procedures in general. And I can tell you, since I adopted this new novel technologies with ablation, either with radio frequency, microwave, or others, I end up doing less surgeries. But you know what? I'm happier. I feel like I'm more fulfilled. I feel I have happier patients who are able to preserve their thyroid, and they are more grateful. And just,
it's
if anything,
refreshing.
I would love to leave a legacy about this. But it's just a very fascinating time that we are studying this and finding that we can do more and more for these patients without the need for aggressive intervention.
It's very refreshing to hear a surgeon say he wants to save the thyroid and really help a patient preserve their quality of life.
Listen, Philip, you know, I did have surgery myself, and my family and many in my close family had many surgeries, and I do have cancer in my family, and I lost my father for cancer. So the word cancer is a big thing, but thyroid cancer is not like other cancers, and we can manage it. So I feel like we just need to really be very careful about being aggressive in certain patients when we just want to be aggressive with interventions, and we need to care about the quality of life. So I'm very sensitive to the word cancer, and I do have a passion for treating cancer patients, but I also have a significant passion for the quality of life.
This is awesome. It's awesome to hear your approach to treating thyroid cancer, thyroid nodules without surgery. I'm curious to see the technology behind it.
All right, Philip, why don't you just come by my office on Monday, and I will show you how easy is this.
No kidding?
It's fun. It's
Really?
a walk in the park. It's very easy and it's fascinating. It's fascinating.
Okay,
knowledge.
so I'll take you up on that. I'll come by Monday.
I'll see you Monday.
Good morning, Dr. Kandil. Happy Monday.
Good morning.
How was the rest of your weekend? Did you go back to the gym or did you go to?
Well, definitely I did not have many more beignets. That was enough for the year. And then, yes, I did CrossFit. Yes.
Dr. Kandil, it's good to be in your office.
Well, welcome.
Thanks. And on Saturday, when we were at the park, you said that you were going to show me the technology on how to avoid thyroid surgery and use this new technology. I'm sitting here at your office, and I see a book you wrote called Thyroid Surgery.
Yeah, I wrote the book on thyroid surgery.
Wow. Okay, but you said today you're going to show me technology how not to do thyroid surgery.
Yeah, we have procedures later on today, and we can go and see the procedures.
So you'll take me to the procedure room.
Absolutely.
On that note, then you want to look at them, whoever's watching this video, and tell them where we're going?
Well, let's go to the procedure room and see some procedures and how we avoid thyroid surgery.
Awesome, looking forward to it.
All right, let's do it.
Kandil,
So,
it was cool to see those procedures.
it's a pleasure.
No, listen, I was in the room while you were treating the patients with the ablation, and I guess the few things...
It was quick, yeah?
Yeah, I was going to say a few things stood out to me. It was a quick procedure
Yeah.
when you were using the microwave.
Yeah, it's very quick. It's very easy for patients and
So-
eventually very fulfilling results.
I think the other things that stood out to me, watching you, I've done over 100 interviews with doctors, but I noticed you're just so attentive. You know, even when putting the drape on the patient, it's you doing it.
I'm doing everything from A to Z, my friend.
It's
Patients
nice.
deserve the best, yeah.
And I guess that's the other thing. For the patient experience, it looked very easy, you know,
Yeah, it's
for
smooth.
them.
Absolutely.
And also, I thought it was your attention to detail while using the ultrasound, you know?
Yeah, absolutely. It's
Eh,
important. I enjoy that.
Yeah, no, there's no doubt about it. You said that you love your craft and you love treating patients.
I love what I do.
Yeah, I can tell. Thanks for the tour of New Orleans. Thank you for the
Well,
introduction
coming.
to microwave. Thank you for the gym.
That's awesome. Yeah,
Thanks for the walk in the park.
We're gonna do this one more time.
Man, and thanks for the beignets.
Yeah, that's awesome.
I gotta
Yeah,
be careful though. I'm gonna go back
We
and
went
eat
to
some
the
more.
gym right after, so no worries. It'll be okay.
Man, thank you.
Sounds good.
Yeah, see you next time.
See you next time.
Okay,
Thank you.
see you.